we'd assume that each orangutan would have 2 copies of each allele, right? 2 copies of this gene for every gene on one of their autosomes, right? One of their kind of, well, from which they inherit, one from their mother and one from the father, right? A dominant allele is an allele that if it's inherited, then just 1 copy is necessary to express that trait. For a recessive allele, you need 2 copies, right? Because, of course, the presence of a dominant and a recessive allele together, as the name would imply, the dominant allele will kind of dominate, and we'll see that trait instead.
It's important to remember that a lot of those symptoms can overlap quite a bit. We take people and their symptoms and try to match them to whatever diagnosis will get them the best treatment, the best support to work for them. Exactly. But it can be a little hard to keep all of those symptoms straight sometimes. So we want to be clear that dissociative identity disorder is going to involve someone having 2 or more distinct personalities, usually in response to past trauma.
Exactly. Whereas schizophrenia usually has a little bit of a later onset and has that constellation of both positive and negative symptoms, lots of hallucinations, delusions, lack of emotion, and so on.
I like to think of barotrauma as in our ears, we have something called aerotitis or barotitis, which is like if you go up in an elevator or you go in a plane, when you're rising and you're landing, you feel that popping in your ears, right? When you swallow, it's really just pressure changes and you have a really thin canal between your nose and your ear. We call that the eustachian tube. And when that's blocked, and then when it suddenly opens, those pressures equalize again, and we hear that pop. We feel that pop.
The vagus nerve, which we mentioned earlier, also stimulates enterochromaffin-like cells, which secrete histamine and act directly on parietal cells. And this also stimulates HCl secretion. And the vagus nerve does one other important thing, which is to act on G cells to secrete gastrin. And this acts on ECL and parietal cells, triggering further production and secretion of HCl. So all of this is leading to a lot of HCl secretion.